When a cardiorespiratory emergency strikes, such as heart attack or choking, it launches the ticking of a personal doomsday clock. A brain deprived of blood can only survive about 4 to 6 minutes before becoming permanently damaged. In another 4 minutes, the blood-starved brain will die. Cardiopulmonary resuscitation, CPR, can slow the clock by delivering oxygenated blood to the brain in time to prevent brain damage and death. For this reason, healthcare providers are expected to be able to skillfully practice CPR. But everyone can, and you should learn CPR because you never know who will be first on the scene in case of cardiac or respiratory arrest. The major requirements for CPR certification are 1 rescuer CPR, 2 rescuer CPR, the use of automated external defibrillators or AEDs, obstructed airway conscious victim, obstructed airway unconscious victim, child rescue, and infant rescue. In addition to CPR, the basic life support program developed by the American Heart Association also addresses other subjects, such as the 4 links in the chain of survival, early access to the emergency response system, early CPR, early defibrillation, and early advanced care. Also addressed are identifying the signs of the 5 major emergencies in adults: heart attack, stroke, cardiac arrest, respiratory arrest, and foreign body airway obstruction. This program, however, focuses on the techniques of CPR. Research shows that the risk of disease transmission when performing CPR is minimal. However, healthcare providers and others who may be required to provide emergency medical care due to the nature of their work should use barrier devices such as protective gloves, eyewear, and mouth barriers in order to absolutely minimize the risk of disease transmission. In addition, universal precautions and other infection control methods from the CDC and OSHA should be followed. For instructional purposes, the use of these devices will not always be shown in this program in order to present clear presentations of CPR techniques. CPR for adults, children, and infants will be described. The American Heart Association defines adults as those at puberty and older, children as those age 1 to puberty, and infants as those 1 year old and younger. CPR is only initiated when a person becomes unresponsive or unconscious, or is found this way.
Are you okay? Are you okay?
After establishing that the person is unresponsive, you should call for help and get the AED before beginning CPR. Calling the emergency response team will get advanced medical care to the person as soon as possible. However, if the unresponsive person of any age is a likely victim of asphyxial arrest, such as drowning, you should deliver 5 cycles of CPR before leaving the victim to call for help and get an AED. After calling for help, begin CPR. CPR procedures are easy to remember if you follow the ABCs and D. A. Airway, B. Breathing, C. Circulation, and D. Defibrillation. Using automated external defibrillators, or AEDs, is an important component of CPR that can dramatically increase the survival rate of cardiac arrest victims requiring CPR. The use of an AED is simple, but requires separate training, which you are encouraged to pursue. First, open the airway by performing a head tilt chin lift. With the fingertips on the bony part of the chin, bring the chin forward while pressing back on the forehead. This is done because the tongue of the unconscious victim may fall back against the throat and block the airway. By tilting the head back, the tongue is lifted away from the throat and the airway is opened. If you think the person has a head or neck injury, use a jaw thrust instead of the head tilt chin lift. Place your fingers at the corners of the victim's jaw, just under the earlobes, and lift the jaw without tilting the head. This will also pull the tongue away from the back of the throat without the possibility of causing additional injury. If a jaw thrust without head extension does not open the airway, use the head tilt chin lift. After opening the airway, B, breathing, is next. Look, listen, and feel for adequate breathing. If breathing is not adequate, administer 2 initial breaths. If immediately available, barrier devices are recommended for administering the breaths. With the head tilted back, make a tight seal around the mouth and nose and take a normal, not a deep breath, and give 2 inspiratory breaths over 1 second each. If the chest does not rise, repeat the airway opening maneuver and give rescue breaths again. Do not use rapid, forceful breaths, as this can force air into the esophagus and stomach and cause vomiting. If a face shield is used, pinch the nose and make a tight seal around the mouth. If mouth-to-mask breathing is performed, be sure to create a tight seal around the victim's face using the proper hand placement on the mask, such as the one shown here. If no barrier device is at hand, you can use the mouth-to-mouth technique. Pinch the nose and make a tight seal around the mouth. You can also use the mouth-to-nose technique by closing the mouth and making a tight seal around the nose. After the 2 initial breaths, C, circulation is next. Check for the carotid pulse by placing your fingertips on the trachea and sliding them into the groove at the side of the neck. Take up to 10 seconds to determine if signs of circulation are present, but no more than 10 seconds. If you cannot detect signs of circulation, restore circulation by giving chest compressions on the lower half of the sternum and be prepared to use an AED. Chest compressions help circulate blood by increasing pressure in the chest cavity. Place the heel of one hand on the sternum between the nipples. Then place the second hand on top of the first hand parallel to it. Compress the adult chest with the heel of your hand 1.5 to 2 inches at the rate of 100 compressions per minute.
1, 2, 3, 4.
To give
5,
effective
6,
chest compressions,
7, 8,
all rescuers
9,
should
10,
push hard
11,
and push
12,
fast.
13, 14,
Let the chest
15,
completely
16,
recoil
17,
after each
18,
compression.
19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After every 30 compressions, give 2 breaths over 1 second each. Then continue compressions. Push straight down with your shoulders directly over the chest. Keep your fingers off the chest so that you will not damage the ribs or decrease the effectiveness of the compression.
1,
It
2,
is extremely
3,
important
4,
that interruptions
5,
of
6,
chest compressions
7,
be kept
8,
to a
9,
minimum.
10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After the first 5 cycles of 30 compressions and 2 breaths, take 5 to 10 seconds to check for signs of circulation, adequate breathing, coughing, or movement in response to the rescue breaths. If there are no signs of circulation, resume CPR beginning with chest compressions. If a pulse is present, but there is no breathing, perform rescue breathing at a rate of 1 breath every 5 to 6 seconds and recheck the pulse every 2 minutes. Watch the victim's chest rise and fall as you perform rescue breathing. When both pulse and breathing are restored, maintain an open airway. If no trauma has been sustained, this is done by placing the victim in a recovery position on his or her side. In 2 rescuer CPR, one rescuer gives compressions at the rate of 100 per minute. The other rescuer delivers 2 breaths over 1 second each after every 30 compressions. This rescuer also monitors for signs of circulation and checks the effectiveness of the compressions. In addition, this rescuer will take no more than 10 seconds to check for spontaneous breathing. This is done after the first 2 minutes and every few minutes thereafter. To give effective chest compressions, all rescuers should push hard and push fast. Let the chest completely recoil after each compression. The rescuer giving compressions should initiate an exchange of position about every 2 minutes or 5 cycles of CPR. The rescuers should try to complete the change in 5 seconds or less. The other rescuer should give 2 breaths, then move into position to give compressions. If there are no signs of circulation, continue CPR. Continue giving CPR until an AED arrives, ALS providers take over, or the victim starts to move. In healthcare settings, face masks and bag masks can be used to provide rescue breathing, either with or without supplemental oxygen. While bag masks can be used by one rescuer, they are more effective when used by two.
I got a pulse.
One rescuer holds open the victim's airway,
Still not breathing.
while firmly sealing the bag mask on the victim's face. The second rescuer squeezes the bag, delivering 2 breaths over 1 second each that clearly make the chest rise. If supplemental oxygen is being used, it should have a flow rate of at least 10 to 12 liters per minute to the airbag. Each breath should last 1 second. Deliver a volume sufficient to make the chest rise. This will reduce gastric inflation and potential consequences of regurgitation, aspiration, and pneumonia. When a person goes into cardiac arrest, most frequently they are experiencing ventricular fibrillation, VF. Early defibrillation is the most effective treatment for VF in persons 1 year old or more. The chances of surviving a heart attack decrease 7 to 10% for every minute without defibrillation. Automated external defibrillators, AEDs, are small computerized defibrillators. They can analyze a victim's heart rhythm for VF or ventricular tachycardia, a similar condition, and can give a shock to the victim to defibrillate the heart if needed. For a single rescuer, after determining that the victim is unresponsive and alerting the emergency response system, give 2 ventilations if the victim is not breathing. If there are no signs of circulation, prepare to use the AED. If there are 2 rescuers, one rescuer should start compressions immediately. The other rescuers should set up the AED. Regardless of what type or model of AED you use, there are 4 universal steps to AED operation. First, turn on the power to the AED. Second, attach the AED's electrode pads on the victim's chest. Third, analyze the victim's heart rhythm. And fourth, deliver a shock to the victim if prompted to do so by the AED. Use of an AED is similar for one rescuer or 2 rescuer CPR. After getting the AED, place the unit near the victim's left ear if possible. This is usually the best position for its use. First, turn on the power to the AED. Some units turn on automatically when opened.
Place electrodes.
Next, attach the electrode pads to the victim. The first one is placed in the upper right area of the victim's bare chest between the clavicle and the right nipple next to the sternum.
Place electrodes.
Place the second pad on the outside of the victim's left nipple,
Place electrodes.
several inches below the left armpit. With some units, the pads are already connected to the cables and to the AED. With other units, you will have to be sure that the AED is connected to the connecting cables, and that the connecting cables are connected to the electrode pads, and that the electrode pads are securely connected to the victim. Analyze the heart rhythm. Begin by clearing the victim so no one is touching the victim.
Clear victim?
I'm clear.
I'm clear.
Do not touch patient. Analyzing rhythm.
Press the Analyze button on the AED to start analysis of the heart rhythm if required. Some models may automatically initiate analysis when the pads are attached properly.
Do not touch patient. Analyzing rhythm. Charging.
If the AED signals shock advised or shock indicated,
Stand clear. Push flashing button to rescue.
Clear victim?
I'm clear.
I'm clear.
Stand clear. Push flashing button to rescue.
and press the shock button. The victim may jerk with muscle contractions. CPR should immediately follow the first shock and should continue for 5 cycles or about 2 minutes. Analyze the heart rhythm again. If prompted by the AED, repeat this process of 1 shock and 5 cycles of 2 rescue breaths and 30 compressions until advanced emergency care arrives or the victim starts to move. If the AED shows a no shock indicated message, but there is no pulse or breathing, resume CPR, beginning with chest compressions. Repeat 5 CPR cycles of 2 rescue breaths and 30 compressions, then check the heart rhythm. Repeat these steps until advanced emergency care arrives or the victim starts to move. If the victim is breathing normally and has a pulse, place the victim in the recovery position. Leave the AED on and attached to the person and continue to monitor their heart rhythm. The use of AEDs is recommended for children 1 year of age and older. The AED should be used after giving 5 cycles or about 2 minutes of CPR. If an AED system is available that reduces the delivered energy dose through the use of special pads or cable or other method, that system should be used for children 1 to 8, but not for children 8 years of age or older or for adults. There are special circumstances you will need to take into consideration before using an AED. If the victim is in water or wet with water or sweat, move them out of the water and dry them off before using the AED. If the victim has an excessively hairy chest, firmly remove the first set of pads to clear the hair from the contact area. In some cases, shaving the contact area may be required. Then, attach a new set of electrode pads. If the victim has an implanted pacemaker or cardioverter defibrillator, placing the electrode pad over the device will reduce the effectiveness of the shock. Look for a scar on the upper part of the chest or abdomen, usually on the left side, and feel for a hard lump about the size of a pager. If a pacemaker or implanted defibrillator is located where the AED pads would normally be placed, place the pads at least 1 inch away from the device. Follow your facility's policy regarding the use of AEDs with patients who have implanted cardiac devices. Finally, if you see a transdermal medication patch on the chest where an electrode pad should be placed, remove the patch and wipe the area clean before attaching the electrode pad.
I worked that double last weekend, and I wasn't able to put my car in the shop, so I might not be able to make it this weekend. You okay? Hey, what's the matter?
The choking victim will usually grasp the throat, exhibiting the choking distress signal. Other signs of severe airway obstruction include poor or no air exchange, increased breathing difficulty, cyanosis, inability to speak or breathe, and a weak, ineffective, silent cough. If any of these signs are observed, step behind the victim. Place the thumb side of your fist against the abdomen in the midline between the umbilicus and the rib cage. Grasp the fist with the other hand and deliver quick upward thrusts. Chest thrusts may be substituted for abdominal thrusts if the victim is obese or pregnant. Pull inward on the middle of the sternum. If the conscious choking victim is in bed, put down the side rail and get in position behind the victim. Continue the thrusts until the foreign object is dislodged or until the victim becomes unconscious. Victims who've had their airway cleared by abdominal thrusts should seek medical attention to ensure against injury resulting from the rescue attempt. After establishing unresponsiveness and activating emergency medical services, perform Step A in the ABCs. If you cannot inflate the lungs, the tongue may be blocking the airway. Tilt the head back farther. If the lungs still do not inflate, the airway may be blocked by a foreign object. Initiate chest compressions. Chest compressions generate pressure equal or greater in force than abdominal thrusts. After giving the compressions, look into the victim's mouth for a foreign object. Use a finger sweep only if a foreign object is seen. If the lungs inflate, give 2 slow initial breaths. Palpate the carotid pulse and, if necessary, proceed with CPR.
Are you okay? Are you okay? I need some help in here.
Do not take time to activate the EMS system until after the child is given 5 cycles or about 2 minutes of compressions and ventilations. This is done in children because the chances are greater that the problem is related to the airway and/or breathing. If there is no breathing, give 2 breaths that make the chest rise. Then take 5 to 10 seconds to check for a pulse. If the pulse is 60 or more but breathing is inadequate or not spontaneous, Give rescue breathing at a faster rate than for an adult, approximately 1 breath every 3 to 5 seconds. If the pulse is 60 or less with poor perfusion, give chest compressions. Chest compressions are given at the rate of approximately 100 per minute. With children, the chest is compressed 1/3 to 1/2 the depth of the chest. 1 or 2 hands can be used for chest compressions with very small children. Give 5 cycles of 30 compressions and 2 breaths. In two-person CPR for a child, compressions are given with 1 or 2 hands on the sternum at the ratio of 15 compressions to 2 breaths. After 5 cycles of CPR, activate EMS and get an AED if this had not been done. Continue CPR with or without an AED as described earlier for adults. For a conscious child, the procedure for clearing the airway is almost the same as for an adult. After determining an airway obstruction, stand or kneel behind the child and perform the Heimlich maneuver. Each thrust should be distinct and delivered with the intent of relieving the obstruction. Repeat the thrusts until the object is dislodged or until the victim becomes unconscious. If the child is found unconscious, the procedure is the same as for an adult. Give 30 compressions and 2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Look in the mouth and remove an object if one is seen. If the lungs still do not inflate, repeat the procedure as rapidly as possible. Finger sweep only if you see the foreign object. If the lungs inflate, proceed with the ABCs.
Baby, I need some help here.
For infants less than 1 year of age, the head should not be tilted back as far as an adult's head. If a barrier device is not used, breaths may need to be given with a seal around the mouth and nose of the infant. Blow only enough air to make the chest rise. Look for signs of circulation. With infants, check the brachial pulse on the inside of the upper arm. Take up to 10 seconds to determine if signs of circulation are present, but no more than 10 seconds. If there is circulation but breathing is not adequate, perform rescue breathing at the rate of 1 gentle breath every 3 seconds. If there is no circulation, give chest compressions with 2 fingers on the middle of the sternum, 1 finger width below the imaginary line that connects the nipples. Compress the chest 1/3 to 1/2 the depth of the chest at the rate of 100 times per minute. Give 5 cycles of 30 compressions and 2 breaths over 1 second each. Reassess the victim after 5 cycles. When 2 rescuers provide infant CPR, use the 2-thumb encircling hands technique. Thumb placement is the same, 1 finger's width below the nipple line on the sternum. The hands should wrap around the sides of the infant's chest. Be sure not to compress on or near the xiphoid process. Also, with very small infants, the thumbs may overlap. Both thumbs compress the chest 1/3 to 1/2 the depth of the chest at the rate of at least 100 times per minute, with 15 compressions for every 2 breaths. If the infant is choking and unable to cry, make noise, or otherwise move air, lay the infant face down, straddling your arm with the head lower than the trunk. Support the head with your hand under the jaw and chest. Give up to 5 back slaps between the shoulder blades with the heel of your hand. Turn the infant over and deliver 5 2-fingered chest thrusts, which are used instead of abdominal thrusts on infants. Repeat back slaps and chest thrusts until the object is dislodged or the infant becomes unconscious. With infants and children, only perform a finger sweep if you see the foreign object. Seek medical attention for infants who have had a foreign body obstruction to check for further injuries. Use the same technique to relieve an airway obstruction in the unconscious infant as used for unconscious adults and children. Perform CPR and look for a foreign object each time the airway is opened. Whether used to save a child or an adult, CPR is a skill that must be learned and practiced. You should be recertified at least every 2 years to maintain your skills, because you never know who will be the first one on scene in case of cardiac or respiratory arrest.